We're very fortunate today to have one of the most exciting leaders on our planet with us today. Michelle Bachelet started out, let me just say this, she has one of the most interesting life stories of anybody that I can imagine. She served as president of her country, Chile, from 2006, and prior to that, she served as defense minister, and prior to that, she served as minister of health. She's lived or studied in Latin America, of course, the United States, Australia, and Europe. Her family was detained and tortured under the Pinochet government, and she has emerged as one of the most admired female leaders, one of the most admired leaders of any gender on the planet today. Just in 2010, as you know, Secretary General Ban Ki-moon established UN Women and appointed President Bachelet to become the UN Undersecretary General and head of UN Women. Already she has begun to design and implement some amazingly exciting programs, many of which have a direct effect on women's health. We at GBCHealth are tremendously cognizant and aware of the special place and role that women have and play in our societies and in our families and in our businesses, and the central importance of their health to our collective success. We work with our member companies through the Healthy Woman, Healthy Economies program to encourage engagement on women's health and gender equity in this regard. And in that context especially, we are tremendously pleased to have the partnership of UN Women, and we are all incredibly lucky to have President, Undersecretary General, Executive Director of UN Women, Michelle Bachelet, with us today.
Good morning, ladies and gentlemen, and thanks, John, for your kind words. It's really wonderful to be here today at the GBCHealth conference, and I thank you for inviting me. But particularly, I want to thank you for all the good work that you have been doing to improve global health and the lives of people around the world. Through the good work that you are doing to tackle AIDS, malaria, or tuberculosis, to prevent blindness, to improve the health of women and children, you're really making the world a better place for all. And you're also contributing to the achievement of the Millennium Development Goals, to which the world's nations have committed. During the next few days, you will be talking about defining forward. As you do, I encourage you to put a special focus on women and girls. I urge to define forward for women. As business leaders, I know you appreciate a good business case, and I can assure you that investing in the health of women is the smart and strategic thing to do. A growing body of research shows that the well-being of women has a positive effect across families, communities, and societies. Women put 90% of their income back into the families and the well-being of the children, and particularly the study shows they put it in health, education, food security. And we know that a child born to a mother who can read is 50% more likely to survive past the age of 5. When mothers are educated and healthy, chances are that children will be too. In fact, studies show that when women are healthy and educated and can participate in the economy, the benefits are many. Poverty, poor health, and malnutrition decline, and living standards and economic growth rise higher. For these reasons and more, UN Women was established more than a year ago. we were establishing the belief that greater progress for women will bring greater progress for all. And we are working with partners to advance women's equal rights, participation, and opportunity. And partnerships are spreading, and I would like to commend you for your Healthy Women, Healthy Economies initiative. And in this regard, there are other initiatives that it's interesting. For example, there is a new research project that is underway, led by government of Norway. This effort involves the UN, the World Bank, the Bill and Melinda Gates Foundation, but many other organizations, to provide better understanding of the ways in which investing in women's health can contribute to economic growth. This research will be presented in the Lancet next year in 2013, and I think you will put even more fuel to the tank so we can go faster and further ahead. UN Women comes from a lot of 4 different entities in the UN, and health was not an issue where we were really involved in. A little bit, but not much. I'm a physician. I'm a medical doctor. I'm a pediatrician also. And for me, it was very disappointed that we were not going into the health business. So we have been trying and pushing very strong to be part of groupings of agencies that were pushing towards improving women's and children's health. And just last month, UN Women joined another UN agencies and organizations in a global partnership to advance the health of every woman and every child. Even though I have to say, all this time we have been working in other areas that are not directly seen as in health, but they are so important. For example, we're pushing to ensure more women in decision-making positions, more women in politics, so we can ensure that more bills will be passed in Parliament towards ensuring women's access to health services, or budget that can really ensure this kind of situation. So we work in many areas, and economic empowerment, because we already mentioned that women devote their income to food security, health, and education, and so on. But the important thing is that in this partnership that we're working on, that was started by Secretary General of the UN in 2010, to accelerate progress on MDGs 4 and 5 to reduce child mortality and improve maternal health. And we need to do much more because women and children are still dying at alarming rates. This year, some 350,000 women will die while giving life, and around 8 million children will not make it to their 5th birthday. In Southern Asia and Sub-Saharan Africa, more than half of all births still take place without the assistance of trained personnel. Some 215 million women who want to plan and space their birth still lack access to effective contraception. And we know that ensuring access to family planning could cut maternal death by an estimated 20 to 35%. And this is it's important for women, but it's particularly important for young women. Pregnancy and maternal conditions are the #1 killers of 15 to 19-year-old adolescent girls worldwide. And these adolescent girls are twice as likely to die during pregnancy or childbirth compared to women in their 20s. And for those under 15, the risks are 5 times higher. And yet, despite this risk, too many girls continue to be married as child brides. Today, 1 in 7 girls in the developing world marries before the age of 15, and this threatens her health and, of course, her future. Every woman, every child is not just about maternal mortality or a specific disease. It is about girls' and women's empowerment. For those reasons, as part of Every Woman, Every Child, you can find commitments by partners to tackle child marriage, to advance training, to address non-communicable diseases that are leading killers such as cancer, diabetes, cardiovascular disease, and respiratory disease. And you just heard a fantastic panel on HIV and AIDS. And for us, it's very clear too the linkage, because when women are in early forced marriage, when women are also victims of domestic violence, they usually have more rates also in HIV/AIDS. So we need to tackle the issues that are so intertwined, many different aspects to really succeed. You can also find commitments in Every Woman, Every Child to promote integrated health care and stronger health systems that reach every person wherever they live. Yet, this mission, to save 16 million women and children by 2015, is challenging, but it is achievable with our collective strength, and we cannot leave this work to governments alone. To date, nearly 200 partners from public and private sector, philanthropic communities, NGOs, and civil society have made commitments totaling about over $40 billion US. And all of you and GBC Health are uniquely positioned to help make some of the biggest gains for women and children around the world. As you mobilize the power of the global business community to build a healthier world, the Every Woman, Every Child platform can help you pursue and realize this important mission. Soon, the UN Commission on Life-Saving Commodities will issue a recommendation on simple but proven medicines and solutions that will provide critical guidance for future efforts in defining forward. There will be specific roles of the business community and the private sector writ large to engage and even lead in meeting these recommendations to support the scope of Every Woman, Every Child. But to achieve success, we need to work together both within but also beyond the health sector. We all know that the conditions in which people live and whether they have access to food, water, or sanitation, and whether they can live free from poverty and discrimination, play a large part in determining their health and also the health of those around them. So there's so much good work that all of you are doing, but there's also much good work that remains to be done. So I want to finalize encouraging and welcoming you to join Every Woman, Every Child, this fast-growing global movement to help improve women's and children's health around the world. In defining forward, I hope you push women's health and equal opportunities for women and girls forward. This will not only enhance business performance, it will also help make our world more inclusive, fair, and sustainable. So again, I thank you, all of us at UN Women, and all of us working to improve the health of every woman and every child. Look forward to working with you. I hope you have a very big, successful meeting. Thank you very much.